My nursing innovation project is on ultraviolet light and decreasing the contamination of portable medical equipment. So, who is it that ensures that portable medical equipment has been properly decontaminated? Usually it is the healthcare staff. For example, we share blood glucose monitors, mobile stands for vital signs, IV pumps, and other equipment between patient to patient, and if they're not properly decontaminated, they're reservoirs for pathogens and end up transmitting those pathogens from patient to patient. And for example, the vitals carts, when they're not in use, they're supposed to be wiped down with medical grade wipes and then plugged into the hallways until another provider needs them. However, it is important to consider how many times are they forgotten to be wiped down, how often are they left outside a room for a moment to be taken by someone else, how often is it assumed that someone else has sanitized the mobile cart so it does not need to be sanitized again. Now, vital signs machines are only one example of the many pieces of portable medical equipment that we rely on in healthcare, and it is the hospital staff that ensure the proper decontamination. Hence, I believe that there needs to be additional interventions. I believe the use of ultraviolet light as a disinfectant should be utilized in hospitals on their portable medical equipment to reduce the transmission of hospital-associated infections and to stop the role that portable medical equipment plays in the transmission cycle of hospital-acquired infections. So, transmission. In one study I found, it looked at all the different portable medical equipment that is used and the most high-touched equipment in hospital rooms, and was looking at the pathogens they had on them before and after manual decontamination. And the study found that patients that occupy hospital rooms where the previous occupant was positive for pathogenic organisms have a 40% increased odds of transmission than those that occupy rooms where the previous occupant was negative for pathogenic organisms. Now, since these patients didn't have direct contact between each other, it can be attributed to the fact that the environment has been contaminated. During that same study, they found that during that manual decontamination period that we have at the hospitals, over 50% of surfaces were completely missed during that manual cleaning, and about 40% of high-touch surfaces were considered inadequately disinfected. This kind of supports the need for additional interventions in addition to that manual decontamination and proper hand hygiene. Another study looked at using no-touch disinfectants such as ultraviolet light and found that it can limit the transmission of pathogens and prevent healthcare associated infections. In the study, they swabbed surfaces, exposed them to the ultraviolet light, and then re-swabbed them to compare the pathogens they had. And the study found that there was a significant reduction in C. diff and VRE numbers on the surfaces. So, in addition to finding that pathogens were reduced by using ultraviolet light, it was actually found that a study doing the same experiment found that the ultraviolet light was broadly effective on many pathogens, and in fact it was seen that hospital-wide there was a 53% reduction in healthcare-associated C. diff infections and a 70% reduction in ICU infections. Then additionally, there was an 87% reduction of ICU cases with the VRE. Overall, these studies found that ultraviolet light reduces the growth of pathogens and in turn reduces the transmission rates of infection within hospitals. So what should we change? Since ultraviolet light has been proven as an effective disinfectant and decreases the transmission of pathogens, I believe implementing stations for portable medical equipment to be docked and sanitized with ultraviolet light would allow for more effective sanitation process rather than solely relying on manual sanitation, which is both prone to error and risks inadequate cleaning of surfaces. Now, it is important to note that CNAs, nurses, and other providers and other staff are the ones who are responsible for docking portable equipment and making sure they're sanitized correctly. So that's why I believe having a station kind of similar to a med room would be useful. You could simply dock the equipment, take equipment out of there, not from the hallways, and the goal would be to have a minimum of a 5-minute cycle for sanitation. In the previous studies I talked about, they did 5 to 10-minute cycles on sanitizing rooms and equipment, and they found as little as 5 minutes already reduced the number of pathogens on equipment. All this being said, manual sanitation and proper hand hygiene cannot be replaced by this no-touch sanitation method with ultraviolet light. Instead, current practices should be augmented with the use of ultraviolet light, and has been, again, proven effective for reducing that transmission of C. diff and VRE, and it can overall reduce the rate of hospital-acquired infections. And there are my references.